question I was going to ask you is we're talking about interprofessional collaboration currently in our course. Can you tell me a little bit about how you implement that into your practice, as well as specifically in more of the intensive care unit?
Yeah, in the ICU in particular, there's quite a bit of collaboration with different services.
Okay.
I think that it would be, I think, considered probably more so a multidisciplinary team approach. Where the surgical team, myself, my residents, and some of my colleagues, we will typically be the ones responsible for the overall care of the patient. But while they're in the ICU, we are going to be doing things like wound care monitoring, making sure that our surgical sites are healing well and appropriately. Establishing some guidelines for things like one-to-one nursing care to look at the surgical sites on a regular basis, which takes a lot of time and effort on the nursing side.
Sure.
And then we have many of these patients on the ventilator, and so they'll have some respiratory issues, and so things like the respiratory rates, fluid status, antibiotics, all these other types of issues that come up. We require oftentimes, the expertise of our ICU teams.
Okay.
And so, there's a lot of collaboration there. And then, it's of course important to think about the patients once they get extubated, and we have to start to ambulate them, and so we'll have our our physical therapy team. Oftentimes, we're working in the head and neck, and so things like swallowing issues and
Okay.
difficulties with feeding are going to be coming up, and so we'll have our speech and swallow team also available on a regular basis for a lot of our patients, and so there's a lot of moving parts.
Sure.
And it really, is needed. In fact, when we have a patient that's sometimes as sick as some of the patients that we work with, to have the expertise of all these individuals coming together to take care of them. Otherwise, these patients, I think, would really lack the care that they should be getting, without having some of these other team members, of course, available.
To have the extensive training in the treatment of conditions, one has to be a part of a team to take care of these patients. It cannot be done alone to treat the various conditions that we deal with on a daily basis. Team approach is definitely key in our area, and especially in the certain areas of GI, for instance, inflammatory bowel disease or Crohn's colitis, ulcerative colitis. You need a team to take care of these sorts of patients because they have many things going on. The registered dietitian, primary care physicians, dermatologists, ophthalmologists, and infectious disease specialists. So there is an interdisciplinary aspect to the different fields of expertise that come together in GI, but also there's an interdisciplinary aspect to the different people on the team in terms of their function or role. Mainly, we have nurses and LVNs who are needed to prep our patients to get them ready for procedures. We have medical technicians who assist me in the GI lab to do colonoscopy and upper endoscopy, to recovery nurses recovering our patients when they're done with sedation and their procedure. So it definitely takes a team in the gastrointestinal area to take care of our patients. Hopefully you've been given a little bit of insight into the interdisciplinary nature of gastrointestinal disease. Thank you.
The interdisciplinary team that I generally work with are doctors, nurse practitioners, registered nurses, licensed vocational nurses, medical assistants. I also collaborate with inpatient registered nurses, doctors, lab technicians, radiology, and also public health, just to name a few. And then as for what makes effective collaboration in an interdisciplinary care team, The first would be just having a mutual respect for the people that you work with, having good interpersonal skills, valuing and managing diversity, good conflict resolution, balancing autonomy and unity in relationships. And then in regards to my patients, just providing prompt referrals and timely communication with the health provider.
I'm Lexi Corgan and I'm an occupational therapist. My role in the ICU would be very limited. I can think of one time that I was there actually, and it is rare, but it was when we knew that this patient was going to be moved out of the ICU and he had severe frostbite on his hands and he was at risk of losing them, so I was doing range of motion on his hands. But other than that, you would rarely see me in the ICU.
A pharmacist's role is to make sure that each patient gets the right medicine at the right time, at the right dose, by the right route. We work within a multidisciplinary team where we speak to doctors about safe and effective prescribing. We speak to nurses about how to give medicines and administer them correctly, for example with IV drugs. We speak to physiotherapists about patients' progress. They pick up on a lot of adverse drug reactions and can tell us a lot about a patient's falls risk, for example. We speak to occupational therapists about patients' cognitive and physical ability with regards to actually managing their medicines once they're discharged from hospital. We speak to dietitians about how medicines interact with foods. Just today I was speaking to a dietitian about a patient who was peg fed and also on an antibiotic that interacted with it. We also speak to social workers organising how medicines will be managed once a patient's been discharged from hospital. We do all this together along with the patient to make sure that each patient gets safe and effective patient-centred care.